Hello and welcome to your first appointment for bioidentical hormones. And we're going to start off today by answering some of the most commonly asked questions. The first question we always get is, what are they? Well, bioidentical hormones are clones of your actual hormones that exist in your body. For instance, testosterone is testosterone. Estradiol is estradiol, not methyl testosterone, like from a pharmaceutical company, or ethinyl estradiol, like Ogen from a pharmaceutical company. What are they made of? Well, bioidentical hormones in our pharmacy are made from yam or from soy. And the reason those two plants are chosen is because they contain a three-ring structure, a chemical structure that's very similar to hormones. And it takes very few manipulations to turn them into the hormones that we want to. In your body, however, your body makes hormones from cholesterol. And the first hormone it makes from cholesterol is pregnenolone. From pregnenolone, which is an adrenal hormone, all of the other hormones are made in your body. How are they different from pharmaceuticals? We touched upon that, but pharmaceutical hormones are alterations of our own hormones. And the reason this is done is because pharmaceutical companies cannot patent natural hormones. They cannot patent a substance that already exists in your body. So what they do is they chemically alter these hormones, and therefore they become unique and patentable. Like we mentioned, testosterone becomes methyltestosterone or testosterone cypionate. Estradiol becomes ethinyl estradiol or Premarin, which stands for pregnant mare's urine. And that's why they do this, so they can have the profitability they're looking for. And there is your answer to number 4 as to why big companies don't make them, simply because they don't have exclusivity and they cannot make the profit they need to. Number 5, the biggest question we get, the trickiest one we get, and the one that they being the FDA and pharmaceutical companies try to use against compounders all the time. And it's largely based on falsities. Are they FDA approved? Well, in a sense, no, because nothing made in a pharmacy can be FDA approved, regardless of what it is, because the FDA oversees manufacturing and not compounding. However, every single bioidentical hormone made in our pharmacy comes from a product that is from an FDA-approved facility, and the ingredient itself is an FDA-approved ingredient. So you have a substance that is made from approved ingredients from approved facilities. However, the final product cannot be FDA-approved. And this would apply as well as if I were to take 2 pharmaceutical drugs, say hydrocortisone cream and nystatin cream, both made by pharmaceutical companies. I mix them 50-50, put them in a jar, and give them to you. That product is no longer FDA approved because it was made in the pharmacy. The next question we get quite often is, are there any studies? The answer to that question is yes, there are a few studies. They're not as numerous as there are on drugs, and that's because drug companies usually sponsor the studies that they need to get their drugs approved. However, there are some independent studies done, which we have a list of and we're happy to give to you. But also there were 2 big studies done by drug companies. One was the Women's Health Initiative and the other was the PEPI trial. In these studies, the main drugs that were used by women were Premarin and Provera, which is a estrogen from pregnant mare's urine and a progestin. And I say progestin because it is a drug form of progesterone. And they found that varying results, but generally there was an increase in breast cancer in patients that used both. However, what they didn't mention was there were several patients that used other types of estrogen and other types of progestins and progesterone. In fact, there was a group of people that used bioidentical hormones in this study, meaning estradiol and progesterone, or in this case prometrium, which is bioidentical in a peanut oil matrix. When they took these patients out into their own group and did the statistical analysis on them, what they found was breast cancer rates did not go up in that group. In fact, they found that they actually went down. Does this mean that I can guarantee you that bioidentical hormones prevent cancer? No, I cannot do that. There's not enough data there. However, it is interesting to note that the average onset of breast cancer is in the 60s. And in a woman's body in her 60s, generally she doesn't have a whole lot of hormones left. She's gone through menopause and has been without hormones for 20 years. So as ridiculous as it sounds, one could make the argument that breast cancer was caused by the lack of hormones. But at any rate, cancer is a multifaceted issue, and no one issue contributes to it. Do I stay on them forever? This is a very big question. Women generally start bioidentical hormones because they have major symptoms and they want to do it a more natural way. What they find is they feel so good, they don't want to come off of them. So they ask if they can stay on them. And the answer is, as long as you're not having any side effects and you're maintaining your mammograms and you feel great, we usually tell them, yes, you can do that. This is interesting because this became the basis for anti-aging medicine. The big basis for anti-aging medicine, ironically, is bioidentical hormones, because they have the biggest impact upon a person and their mood and their activity level and their appearance. So I don't refer to it as anti-aging medicine, I refer to it as quality of life medicine. Okay, and this is just an illustration of what we talked about. Cholesterol in the body turns into pregnenolone via enzyme, and then from there all the other hormones are made. It's interesting to note that as we age, the enzyme required to do this depletes and is not nearly as effective as it used to be. So what all of us tend to see is a slow creeping up of our cholesterol levels. And none of us seem to understand why. You know, we try to blame it on diet, but diet is only responsible for roughly 10%. My personal belief is that our bodies try to make pregnenolone, do not have enough enzyme to do so, and therefore they compensate in a futile attempt to make pregnenolone and other hormones by producing more and more cholesterol. However, this is just my theory. Okay, bioidentical hormones made in the lab. Here's an illustration. They're made from soy and yam, as we talked about. Perimenopause, and this is a very big subject. Perimenopause is pseudomenopause. Menopause is defined as being amenorrheic or without menses for over a year. Perimenopause, you can still have a menses and have major symptoms. And it's interesting to note that the very first three symptoms I always see in a woman when they come in is they come in and complain that they can't sleep, they're very moody, and they've gained 10 pounds and they don't know why. What I don't know why is it's always 10 pounds, but that seems to be the answer. There's a very good reason for this. The first hormone to disappear in perimenopause is progesterone. Progesterone is a wonderful medication or wonderful endogenous substance because it does many things. One, it elevates serotonin. Most people are familiar with the word serotonin. It is a neurotransmitter. It alleviates depression. In fact, Prozac is an SSRI, selective serotonin reuptake inhibitor, and it elevates serotonin. So in a sense, progesterone is its natural SSRI. Mood swings. Well, progesterone also elevates something called GABA. GABA is a natural neurotransmitter that it has a sedative or a calming type effect. So you take that away, what do you get? Moodiness. Makes total sense. Waking. This one's a little more complicated, but it makes total sense. When progesterone goes away, your estrogen becomes dominant in that situation. And in that situation, when you have lots of estrogen and not enough progesterone, your body produces something called thyroid binding globulin, TBG. What that does is exactly what the name says. It binds up active thyroid and takes it out of the blood, which has the net effect of slowing your metabolism. So again, to reiterate, early menopause, The cause, progesterone. Lower progesterone, lower serotonin, and lower GABA, and higher TBG, which is not mentioned there. Other symptoms of hormone deficiency, and there's a myriad of them, but these are just a few. Hot flashes, night sweats, osteoporosis, osteopenia, decreased libido, low energy, dry eyes, vaginal dryness, vaginal atrophy, dry skin, low body temperature, depression, low motivation. All of those can be symptoms. Next, this slide is here to illustrate the difference between natural and unnatural hormones. If you take a look on the left, natural progesterone, very simple looking molecule. If you look on the right, medroxyprogesterone is more of a scary looking molecule. And to give you an idea, the typical doses for natural progesterone is 100 milligrams or 200 milligrams. Provera, however, is dosed in 2, 5, and 10 milligrams. So that'll give you an idea of the potency some of these synthetics have. And indeed, Provera has been definitively linked to certain increases in uterine cancers. Okay, and the next slide again is just to reiterate that cholesterol requires an enzyme to make pregnenolone in the body. Okay, this is a very simple and quick, succinct list of what hormones treat in your body. Estradiol treats hot flashes, night sweats, bone loss, vaginal dryness. Progesterone treats insomnia, mood swings, depression, anxiety, weight gain, and what's not listed there is that progesterone can actually help rebuild bone. It does this by increasing the number of osteoblasts found in your bone tissue. The same goes for testosterone. It not only stops bone loss, it helps to regrow bone. But testosterone also helps to treat low libido, low energy, loss of muscle mass, low motivation, and actually sexual response is treated by testosterone. Adrenal hormones that are not very frequently mentioned but are very important. One was the pregnenolone we mentioned. Two was the DHEA. Together they treat things like lack of well-being, dry eye syndrome, believe it or not, seasonal allergies, elevated LDL. What we found is that in several patients, if we give them pregnenolone and DHEA, their cholesterol levels, especially their LDLs, drop, which makes sense because of that response we talked about. The body no longer needs to make more cholesterol in that attempt to make more hormones. Thyroid. Most people know somewhat about this. Slows your metabolism if you don't have enough. Low body temperature. 98.6 is normal. 97.6 is not normal. It's not normal for you. It's not normal for anyone. So if you have a low body temperature, chances are there's a thyroid issue underlying. Depression, lethargy, hair loss. Those are all symptoms of low thyroid. This slide shows a simple list between natural and synthetic. And again, you can look at estradiol and then look at Premarin, which looks like some kind of alien DNA. You can look at progesterone versus medroxyprogesterone and testosterone versus testosterone cypionate. Okay, next, this is a very touchy subject and one that's a hot topic right now. A new way of thinking in thyroid. Old school thinking gets you old school results. The old school way of doing things is to simply check something called TSH, which stands for thyroid stimulating hormone. What's interesting about this is that TSH is not even a thyroid hormone. You would think if you want to know what somebody's thyroid level is, you would check their thyroid level. But thyroid stimulating hormone is secreted by the pituitary in an attempt to get the thyroid to release thyroid hormones. The thought being that if it's too high, your thyroid is not responding to that and that you need thyroid. However, we do not believe that is enough. And the reason is we believe you should check your TSH, your T4, which is a thyroid hormone. However, it's relatively inactive compared to something called T3, something called reverse T3 thyroid antibodies. All of those should be checked. And the reason is simple. You want to know what your thyroid's doing, check all of them. Check every hormone you have. And we have seen numerous cases, and I mean numerous cases, of patients that have normal TSH, normal T4, and low or very, very low normal T3. And those patients are highly symptomatic. They have cold hands, cold feet, low body temperature, constipation is a big one, hair loss. All of these things, brittle nails, all of these things can be signs of low thyroid. So it's important to check all of them, not just one test. So we went over symptoms of low thyroid, and I'm sure all of you, or many of you that have suspected you've had a thyroid issue, have been given the line, "You're normal. My doctor says I'm normal." That's usually because he's only done one test. And we have a number of new studies showing why you need to check all of these things, and we will be happy to provide them for you. Next, we're going to talk simply about adrenal hormones. We've mentioned them before already, but pregnenolone is the mother hormone that on its own has an intrinsic value of, it's an anti-inflammatory, it helps with mental acuity, and theoretically can help lower that LDL. DHEA was the first anti-aging hormone created, and it was created because they found that every disease state that resulted in death was accompanied by a low DHEA. The thought being that if you elevate DHEA, you would simply stop all these disease states. That, in fact, did not happen. However, they found out some wonderful things about DHEA. Like, one, it helps modulate allergies. 2, it acts as a natural anti-inflammatory. 3, the reason I take it, it cured my dry eye syndrome. The last one that we check is cortisol, which is the stress response hormone. When you're under high duress or stress, levels tend to be elevated. High levels of cholesterol can result in things like excessive body fluid retention, higher blood pressure, things like that. Low cholesterol results in great amounts of inflammation in the body. So you need to have a balance between all of that. Okay, finally we're getting down to your first appointment, your symptom sheet. You'll be given a symptom sheet. It's very important that you answer this honestly and completely, because we not only use your symptoms and blood work, but I should say primarily we use your symptom sheet, because we're not treating a number, we're treating a symptom. Medical history, you'll be given a lab slip. You'll be watching this informational video and meeting with your local practitioner there. But at this point, it's a good time to mention that there's an entire team working with you, not just the practitioner you meet with there and the physicians you have there, but we also, in our clinical services, have a physician on staff on our end, 3 clinical pharmacists, and all of us observe your blood work, your symptoms, and formulate a formula for you. And then we also monitor and adjust according to changes in symptoms and blood results. So you have probably the best care you're going to see out there today, because you've got no less than 6 to 7 practitioners all involved intimately in your therapy. The last thing I'd like to mention is it's very, very important that you keep a journal of symptoms. Tell us on a calendar if you'd like what's getting better, what's not. If a symptom occurs, let us know. But keep very good notes. It helps us the most. And secondly, to stay on your schedule for your appointment as far as taking your medications. Take them exactly as you would when you go in for your next blood draw or your follow-up, and just record the time that you did take them before the lab draw. And finally, what to expect your first month. Side effects, there aren't really any side effects because you can't have side effects to your own substances. However, you can have symptoms of imbalance. First one is changes in water balance. You may gain a few pounds of water, you may lose a few pounds of water. Breast tenderness, very common. It should subside over the month. If it does not, it usually requires an adjustment in hormone levels. How long do symptoms take to go away? This varies greatly from person to person, but to give you some averages, insomnia, 1 to 2 days. Hot flashes, 7 to 10 days. Mood swings, 1 to 2 weeks. I've seen them go away in a day. Libido, 2 to 3 months. Very common for it to take longer. And in women, I've finally figured out after 21 years that libido, women need other things to be intact for libido to be there. If they're having hot flashes and night sweats and mood swings, they tend to not think about sex. So it's very important that we treat all the symptoms, and then usually when we accomplish that goal, I get things like, wow, the testosterone kicked in, everything's great now. And it's just simply the fact that we need to get everything in line for them. But overall, they vary person to person. So lastly, I'd like to tell you a little bit, just a tiny bit about myself. My name's Mitch Spryer, and I am a clinical pharmacist. I was trained by the actual creator of bioidentical hormones. I've been doing this for 21 years, and I have monitored, created, and adjusted over 20,000 formulas. And I can honestly say I've learned the most from you guys, from patients. I've learned a ton from some great physicians along the way, but the most knowledge has come from you guys. So it's very important to keep those notes and give us really good feedback. Thanks again, and good luck with your therapy.